This presentation will provide a brief introduction to the concept of quality improvement. It was designed specifically for Jefferson County Public Health and was developed by the Internal Quality Improvement Council. This training will briefly convert the concept of quality improvement, addressing the culture of quality improvement, a couple different quality improvement models, and the internal infrastructure that supports quality improvement. This video should be watched alongside two additional videos. One talks about quality improvement in healthcare, and the second shows a public health case study from New York. You will be able to watch those two videos at the end of this introduction. What is quality improvement? Quality improvement is a formal approach to the analysis of performance and systemic efforts to improve an issue. Quality improvement is a term that is used to describe a couple different things. Quality improvement is an organizational value. In order for an organization to develop a culture of quality, which we will talk about a bit more in just a minute, the organization and its staff members must value quality improvement. Quality improvement is also a method that is used to improve products and processes. There are many different types of quality improvement models, such as Plan, Do, Study, Act, which is also known as PDSA. All of these models create a carefully planned process for improvement. True quality improvement is never random. It is always the result of a structured process. Quality improvement also requires organization infrastructure. This includes a performance management system so that the organization can identify areas that may need improvement. This includes a group that will oversee the process internally, providing training and guidance to the process. Finally, there should be a quality improvement plan that explains the quality improvement process. Let's talk about each of these components in a bit more detail. According to the National Association of County and City Health Officials, the culture of an organization is the embodiment of the core values, guiding principles, behaviors, and attitudes that collectively contribute to its daily operations. Culture drives the policies, practices, and processes used to accomplish an organization's work. It matures over many years as norms are passed from one generation of staff to the next. Shifting an organization's culture requires commitment and deliberate management of the change process. When a quality culture is achieved, all employees, from senior leadership to frontline staff, have infused quality improvement into the way they do business daily. Employees continuously consider how processes can be improved, and quality improvement is no longer seen as an additional task, but a frame of mind in which the application of quality improvement is second nature. Organizational culture is the very essence of how work is accomplished. It matures over several years, during which norms are passed from one generation of staff to the next. The following are components of a strong culture of quality improvement. Leadership commitment. Leadership commitment is vital for the success and sustainability of a culture of quality. Employee empowerment and commitment. Leadership should empower staff to infuse quality improvement into their daily work by ensuring they have the necessary awareness, knowledge, skills, resources, and support. Customer focus. Because customer focus is a core tenet of quality, it should be incorporated into the vision and values of the agency. Services offered should be customer-driven, and continuous assessment of internal and external customer needs should drive improvement efforts to make and exceed customer expectations and prevent dissatisfaction. Teamwork and collaboration. In an organization with a culture of quality, teams have clearly defined performance expectations and gather routinely to brainstorm, solve problems, implement quality improvement projects, and share lessons learned. Continuous process improvement. Abandoning the notion of perfection, continuous process improvement is a never-ending quest to improve processes by identifying root causes of problems. Process improvement involves making a gradual improvement in everyday processes to reduce variation and redundancies, improve quality of services, and increase customer satisfaction. There are many different quality improvement models. This include PDCA, PDSA, Lean, Six Sigma, and the list goes on. At the Jefferson County Public Health Department, we are using a Plan, Do, Study, Act, or PDSA. Approach. Most of the work will take place during the planning stages of the PDSA cycle. There are many quality improvement tools that can help a team accomplish each step in the quality improvement process. You may be familiar with some of these tools, such as the AIM statement, a cause and effect diagram, the 5 ways, or a flowchart. To build a culture of quality improvement, infrastructure must be in place to ensure that quality improvement efforts are aligned with the organization's mission, vision, and strategic direction. The following are components of Jefferson County Public Health's quality improvement infrastructure. Our performance management system will be used to identify areas for improvement, which may make great quality improvement projects. These two systems, performance management and quality improvement, rely heavily on each other. JCPH convened a Quality Improvement Council to oversee these processes internally. The Quality Improvement Council provides ongoing leadership and oversight to continuous quality improvement activities. The Quality Improvement Council consists of 14 cross-sectional representatives from executive management, leadership, and general staff. The Quality Improvement Council will always have at least one member from each division. JCPH's Quality Improvement Plan was created by the Quality Improvement Council. The plan outlines the internal process to identify, select, and complete quality improvement projects. This plan is available for all staff to read on Power DMS. There is also a flowchart of the entire process. This chart and a frequently asked questions page is shared with all staff in Power DMS. The definition of quality varies, but will always ultimately depend on the stakeholders or consumers that will be utilizing the end product or service or experiencing the process. This process should be the result of co-production. Co-production is a practice in the delivery of public services in which citizens are involved in the creation of public policies and services. It is contrasted with the transaction-based method of service delivery in which citizens consume public services which are conceived of and provided by governments. Co-production is possible in the private and nonprofit sectors in addition to the public sector. In contrast with traditional citizen involvement, citizens are not only consulted, but are a part of the conception, design, steering, and management of services. Our understanding of what quality should be is a result of a co-production with our clients and coworkers. The definition of quality will also vary based on the specific circumstances and perceptions and timing. On the other hand, how do we know if something was actually an improvement? This is pretty straightforward, though it can be the hardest part in public health practice. We will know that there has been an improvement because we will have measured it. Measurement is a key component of quality improvement. So, what is the difference between quality improvement and quality assurance? Quality improvement is about taking action to improve a process. Quality assurance is about monitoring a process to assess current performance and comparing that to a set of benchmarks. A good example of quality assurance can be found in our restaurant inspection program. The restaurant inspection program follows a set of standards developed by the Food and Drug Administration. One of these standards requires us to have a procedure on how to conduct inspections. Inspections are trained according to the written procedure. Inspection reports are reviewed against the requirements of the procedure. Comparing inspections to these standards or a benchmark is quality assurance. We are comparing work to a given set of standards. For example, if inspectors are not following the written procedure, then a quality improvement action needs to take place to improve the way an inspection is done, thus meeting the standard. This is when a quality improvement project may be developed and aspects of the project are measured to see how improvements have been made. Other programs have standards as well. Standards may come from an outside agency or even internally. Standards or procedures may also be called best practices. And that is a quick overview of quality improvement at Jefferson County Public Health. If you have any questions, please reach out to your supervisor or division director or our current quality improvement coordinator, Kelly Keenan. Next, you will be asked to watch 2 additional short videos. One talks about quality improvement in healthcare. While there are obvious differences between healthcare and public health, and some of the examples may not be relevant to all staff here at JCPH, overall the video does a fantastic job at explaining the concepts. The second video you will be asked to watch shows a public health quality improvement case study from New York.